there, welcome back. My name is Sheldon McLeod. This is Thinking Out Loud, presented to you here exclusively by the SaltWire Network. And again, I'll invite you to check out the new SaltWire YouTube channel. We're starting to populate that with the videos from reporters and people from across our region. So just ask if you have a little bit of time, do that, like and share, and do all the things that they ask you to do for that platform. And again, a big thanks to SaltWire and the SaltWire Network. This story was quite the headline. New data reveals mixed news for Nova Scotia's healthcare system challenges. This had to do with some information that came from the government of Nova Scotia on Friday that said they have made progress, but they still have work to do. And a matter of fact, we're talking about how many folks are looking for doctors or waiting for primary care and offloading ambulance time. That actually looks like it's going down. And some of the other issues or challenges with our healthcare system. And to talk a little bit more about this, actually, there was something else that came across my email inbox this morning, and it was this document talking about, wait times at the QE2. And this was something that was asked for at public accounts. That information did not necessarily come at the time, and here it is being released today. And I wanted to say welcome back to Brendan Maguire, the MLA for Halifax-Atlantic, former minister in government, a former cabinet minister, so you'll carry that title of honorary or honorable for now and into the future. Yeah. Brendan Maguire, thanks for doing this.
Thank you, sir. Appreciate it.
The issue of healthcare. Are you moved at all by the fact the government says, yeah, we know things are getting better, but there's some areas we still need to work at?
Well, I mean, what the public release was compared to the information that came out are two different stories. So what we heard from the government is that things are getting better, but what we actually saw from the numbers that I had originally asked for in public accounts, and we got them on Friday, was wait times at the IWK now are about eight hours. If you 6 to 8 hours if you take your kids into emergency, in a lot of cases more. That over 44,000 Nova Scotian youth walked out of the emergency room at the IWK without being served last year, without seeing anyone last year because of wait times. And the wait times at the QE2 emergency room are going up. And of course, the need a family doctor list has skyrocketed. It's almost doubled. So, what's happening here is that the government is picking and choosing. And like most governments do, obviously, but they were really picking and choosing some of the good stuff. But the actual on-the-ground experience for Nova Scotians, you could talk to anyone, and it's getting worse and worse.
And to that point, you are a member of a government where we saw steadily declining benchmarks, longer wait times. In fact, more Nova Scotians were looking for a doctor at the end of the term. And I'm not trying to make this political, but this is a political process. So when you see government presenting this information, how do you then, in effect, as your job, in your role as critic, bring them to where you would like to see them going, where you feel Nova Scotians want to go?
Well, what I would say is before COVID actually hit, for the first time in a long time, the need a family doctor list was actually decreasing. And of course, COVID threw a bit of a wrench into that. But now we're out of it. I should say we're out of it. We're learning to live with COVID, and it is still vastly impacting our healthcare system. What I would say is that this is a government that spent more money in the last budget than any government before them. They spent $13 billion and said, we are going to fix healthcare, period. When we tried to ask them questions in question period, they would mock us and say, we're here to fix healthcare, and we're fixing healthcare, and it's getting better, and we just spent $13 billion. And the truth is that you got to have a bit of modesty in the stuff, and you've got to show some humility. And healthcare, while politics is political, healthcare should not be political. And I say this for every party, the NDP, Liberal, or Conservatives. One of the problems that all parties, when they're in government, face is that they refuse to listen to the other sides. Now, we've brought forward lots of suggestions in the last 3 sessions. None of those bills passed. None of them were partisan bills. We brought forward suggestions around diabetes. We brought forward suggestions around physician assistants and things like that. What I would say right now is instead of thinking that you're the only ones with the answers, you see that the numbers are declining, they're getting worse. Now is the time to say, we're going to put politics aside and actually come up with solutions that work for everybody. Because truthfully, Sheldon, nobody goes into the emergency room and says, well, I'm a Liberal, I'm a Conservative, I'm an NDP. They don't care.
Fair comment, but I see the news release that came out said the Houston government promised Nova Scotians they would fix healthcare, but instead they have chosen to take a hands-off approach when we need leadership the most. And I'm sure I'm sure that Tim Houston would say to you that, he's asking healthcare workers what they want, that he is listening to the people in the system, that he's doing what he can. And he may very well take some umbrage to hands off. So tell me how you're interpreting that.
Well, what I would say is there's a time to take a hands-off approach, and there's a time not to take a hands-off approach. And a good example of that was the other week where Dr. Strang and Dr. Link did a press conference around influenza season, respiratory season. And if you listen to Dr. Link, who's one of the senior leaders at the IWK, he said this is the worst it's been since the 90s. And one of the reasons is that the vaccine uptake for influenza and the respiratory illness is at an all-time low. That is a time the premier was 6 floors above. He could have came down the elevator, as we've seen with previous premiers, sit with the leaders, with Dr. Strang, Dr. Link, and show support. If you go through the premier's social media, there is not a single mention about get vaccinated to combat the flu season. So these are very simple things that should not have a hands-off approach. The leaders at the IWK were asking for some direction and some leadership, and the premier was nowhere to be seen. I agree. You should be listening to healthcare workers. You should be doing, they are doing this tour around Nova Scotia, but I signed up for the tour to go to one of them. You have to tell them in advance what your question is, and there's a good chance that even though you signed up, you won't get accepted to go to these events. So if you really want to hear from the public and healthcare workers, don't ask them to submit their question in advance and then approve their questions.
I think you would agree with me that a lot of folks are tired of politics, of the partisan nature, and that they just want to see results. And that,
right.
So how is it as opposition you can say, okay, here's my suggestion, and if a government believes a bill or a piece of legislation is strong enough, they'll either co-opt it, use part of it, or use it exclusively. Not always, but that has happened in the past. So just curious how you then say, well, I don't have the answers, but they don't have the answers either. That doesn't seem to instill any confidence in the system.
Right. So I'm a firm believer in when it comes to healthcare, when it comes to most things that impact Nova Scotians and people in general, as I act, like the way I carry myself in my own community is I don't care who takes the credit, to be quite frank with you. And there are times where I put forward healthcare bills and I've approached the government side and said, listen, scratch my name off it, put your name to it, and just say it's your idea. I don't care. This idea did not come from me. It came from Doctors Nova Scotia. It came from the nurses. It came from the general public. It came from other jurisdictions where it works. So, I understand that, you made a promise to fix healthcare, just like Steve McNeil made promises in the past, and people, they're going to have to go back to the elector, to the voters and say, look, we kept our promises. So right now, to be honest with you, what I would say to government is just take a moment, listen to the opposition, because we're doing research too. Listen to other jurisdictions, and if it's about taking credit, I will repeat this over and over. I'm a firm believer, if someone needs to have the credit in order for a good idea to go through, you can have it. I don't care. You could call. I said to one of the ministers, and I'm not going to say who. There was a bill that I put forward, and it didn't go through. And I said, listen, you take the bill and put your name on it. Call it the whatever minister of whatever bill. As long as it goes through, I don't care. So I think we have to. I think the general public is tired. They're sick and tired of the bickering, the fighting, and the patting each other on the back. I think politicians and politics in itself is a noble profession to get into, but unfortunately, sometimes we get so stuck in the weed on taking credit that it really casts a dark shadow over the profession. So, what I would say to the Houston government is, one of the things you could do is come up with a all-party committee. You can take credit for it and sit down and work with all parties on healthcare, because healthcare affects each and every one of us, whether we're political or not.
And I felt that's what we did at the start of the pandemic, is that regardless of who the leader was or what party they were affiliated with, that's how we approached it. But this issue about healthcare crisis is right across this country. And British Columbia recently announced it was going to move away from fee-for-service. There was a letter to the Chronicle Herald saying, listen, it was a doctor saying, I joined the profession to help people. Now I'm a business person, and that's complicated. Do you, as the shadow minister, the critic, if you will, have a position on fee for service or ways to address the workload life balance for physicians who are burned out?
Well, I think it's a mixed model. So I can tell you that I don't have a family doctor now, but the family doctor that I used to have was he wanted fee for service, and that's what he wanted. Unfortunately, we're in a very competitive. Fortunately and unfortunately, we're in a very competitive environment when it comes to healthcare. So I don't think that one model fits all. We do have the younger professionals that are coming out of school love the collaborative care. If you speak to them, my former family doctor used to work 80 hours a week, and that's what he wanted to do. But we see as young healthcare professionals coming out, they want a more balanced work life. And so when a doctor retires, when a family doctor retires, it usually takes 2 or 3 doctors to replace them. And that really in itself is not sustainable because we're constantly competing for doctors. So I think it's a mixed bag, and I'm not trying to, not give you an answer, because the real answer is that it is a mixed bag. You're going to have doctors that are coming out and saying that I still want to do fee for service, and then you're going to have other doctors that are going to say that I want collaborative care and I want to get paid a salary. So what I would say is that we need to listen to the doctors. We need to be flexible on this stuff, but we also have to empower and widen the scope of other healthcare professionals like pharmacists and nurse practitioners. We have a nurse practitioner here in Spryfield that does an amazing job, and it's really taken the workload off of a lot of the family doctors. So those are things we have to do, and part of the solution is physician assistants and other. So we just have to get creative.
All right, your final word. What do you say to Premier Tim Houston? What do you say to him about healthcare?
Well, listen, I honestly and truly believe that I'm rooting for any government. It doesn't matter what parties in power. I'm rooting for them to do what's right for Nova Scotians and to be successful. Because even though he's conservative and I'm liberal, a successful Tim Houston means a successful Nova Scotia, and that's the God's honest truth there. But I also think that you have to be upfront, forward, and honest with Nova Scotians when it comes to numbers, whether it's COVID, influenza, a family doctor list, the wait times, things like that. Parents and Nova Scotians need to make an educated decision on healthcare and when and how to get that healthcare, and they can't do it without the numbers. And we saw that in public accounts where the government was not prepared to answer questions. We've seen it in question period with Tim Houston, where he will not answer healthcare questions. And all I would say to him is that even though the news sometimes can be rough and the information that you're giving isn't always the best information, being a leader means that you give all that information, whether it's good or bad.
Coming up on 10 years in politics. I know I mentioned this to you before, 2013 to 2023. That's a large part of your life.
Well, it is. And I think I've said this to you before. I don't think this is a job that you do for 20, 30 years. I think after a while you have to look around and you see other people around you and that maybe have more energy and they look at the world a little different than you. I still feel like I have a few good years left in me. I made a promise to myself and to this community. For me, it's about paying the community back. Obviously, with all the different foster families and support that I've had in this community throughout the years, this community saved my life, and I still feel like I have a huge debt of gratitude to them. But, I can tell you this, Sheldon, I don't plan on doing this when I'm 60. I just think that after a while, you have to look around and realize, but right now I'm loving it. I've got tons of energy, and I couldn't ask for a better community.
He is the Liberal MLA for Halifax-Atlantic, is Brendan Maguire. He's the shadow minister or critic for healthcare for the Liberal Party. Thank you again.
Thank you, Sheldon.